Hey dental fans, I'm Dr. Rich. In today's episode of Ask Dr. Rich, I'm going to answer a question that I hear a lot at my office. Specifically, am I too old for dental implants? Well, it depends. Age by itself is not a reason to not get dental implants. The things that could affect getting in dental implants are some of the health problems that arise as people get older. So as long as you're in fairly good health and you have good dexterity in your hands so that you can maintain the implants, there's no reason why age should stop you from getting dental implants. Things that may cause you to reconsider getting dental implants as you get older is if you're a diabetic. Diabetics tend not to do as well with dental implants. They just don't heal as well. That's why they have other physical issues from the diabetes. Also, certain medications, for instance, women who are taking stuff like Fosamax for osteoporosis. That's, if you're on Fosamax, there's a chance you can get something called osteonecrosis, which could be pretty serious. It's pretty rare, but it could happen. So it's something to consider talking with your medical doctor about. A lot of people, though, think, oh, I'm too old. I'm not going to be around in a few months, or even the 6 months, 5 to 6 months it takes for the implant to heal and to get restored and get a tooth put on it. Well, that's kind of a judgment call on your part. I learned my lesson several years ago. I had a patient who came in, 87 years old. He's had some issues with his bottom front teeth. We were trying to nurse him along, try to get some more years out of it. Finally, he got to the point where his bottom front teeth, his lower incisors were failing and needed to come out. So once I told him, all right, we have to pull your lower incisors, I start talking to him about replacement options. And due to his age and just his personality, I figured out he's going to opt for a removable bridge of some type. And so I start talking about different removable bridges, and he stops me. And he's like, "Doc, is this going to move around when I'm trying to eat, when I'm out? Because I want to be able to kiss the ladies. I don't want my teeth moving when I'm trying to kiss the ladies." So I got a good chuckle out of that, and I ended up placing 2 implants and making a 4-tooth bridge to replace his failing lower incisors. And so he was 87 when we did that. I last saw him a couple months ago. He's now 91, and he's still kissing the ladies. So it really depends on your mindset. If you feel up for it, definitely, you're never too old for dental implants just due to age. Similarly, I have another patient who was in his, 88 when he ended up losing some back teeth, and now he doesn't have any upper back teeth on one side, and he and I discussed having some implants placed. At the time, he's like, I'm 88, how much longer do I have? And especially when I told him, it's probably, figure 5 to 6 months from start to finish for the whole process to get those teeth in. So he said, I might not even be around in 6 months. I was like, okay, no problem. And it's funny, it ended up becoming almost like an Abbott and Costello routine. Every 6 months he comes in for a checkup and a cleaning. He asked me about replacing his teeth. I talked to him about implants and how long it's going to take. And he always gives me the same answer. I'm not going to be around in 6 months. And this has been going on since that first conversation when he was 88. He's now 92, and we're still having the same conversation. So it's all up to the person, though, at the end of the day. They got to do what's right for them. Thank you all so much for watching. I appreciate the questions and appreciate the response and the subscribers. If you're enjoying these types of videos, please give me a thumbs up and hit the subscribe button, and I will see you in the next video. Bye-bye.